During pregnancy, you'll be offered a range of screening tests. They'll also give you information on tests following birth. One of those tests is day 5 neonatal screening. That is a blood test that is offered on day 5 following birth, and that is for the baby. Sometimes these are done at home, sometimes they are done in a clinic. It completely depends upon the area. Those blood tests are taken for metabolic disorders of the blood, such as sickle cell thalassemia, cystic fibrosis, other metabolic disorders, and you can find more information on the government website about newborn screening. If you just type that in, that'll find the information for you. Alongside this, the midwife or support worker that does that appointment for you will also weigh the baby, check the baby from head to toe, check the baby's cord, talk to you about feeding, however you're feeding baby. They'll be asking you how much baby's feeding, how frequently, just to make sure that the feeding is sort of getting settled and all is well. We'll also ask about baby's wet and dirty nappies, because this is often a good sign of the milk that's going into baby, because it will also be coming out. They'll also be seeing how you are, how your recovery post-birth is, and you are able to ask questions of those healthcare professionals should you need to, and ask them to explain a little bit more about the tests. The results will come out to you via post, unless the hospital needs to speak to you beforehand, and that will be a phone call. So you will also be asked the most up-to-date phone call for yourself, and the screening card number will be entered into baby's red book, which is a book that documents all baby's health in the early months and years, and you'll be given that once baby's born.